here today with Daniel Zikovitz. He's one of the presenters at the HITLAB Innovation Summit. And Daniel, you're with GE Healthcare. And I love the title of your presentation, The Future of AI in Healthcare. Kind of a broad palette there, a lot of colors to work with. What was the gist of your message, and how do you think it was received?
Yeah, so the message is really we're moving from point-to-point type solutions where we just look at one image and one disease type. And we're moving to more broad-based generative AI solutions that we're going to actually have a conversation. Now, while those have not been regulated yet by the FDA, the future will be that these algorithms will be. The point-to-point solutions, we do know there's 882 of those that are currently, that have passed FDA regulation. Mm-hmm. But I think there's quite a ways to go before the FDA can regulate these Gen AI type models. But it's going to be very helpful from the clinician standpoint. It's explainable AI. They can ask questions to the AI. The AI can ask the radiologist questions or the clinician questions. And so it's really more of a virtual colleague that they're going to work with, as opposed to today where they just get a point solution back that this is positive for cancer.
So you're really building, you're actually adding another member of the team in a sort of about the most non-traditional way that you possibly could.
Mm-hmm. And in fact, we can add multiple team members. So I talked about agentic AI, which is a big hot topic right now. And the agentic AIs, we can have multiple agents. So we could have one that's a radiologist, one that's an oncologist, one that's a pathologist, and so on and so forth. And we could run virtual tumor boards. But we can also have those agents work with real clinicians. And so we can go backwards and forwards in conversations and find what patients are very viable for certain clinical trials, mm-hmm. and treatment options for things like oncology. So that's kind of one of the areas we're going to start at, building an agentic AI model for oncology.
It's pretty remarkable, isn't it? Mm-hmm. I mean, to think about it, just to even conjure that maybe even 2-3 years ago was just so far pie in the sky. So how important is it for the questions to be fairly focused?
So it is fairly important for the questions, but the neat thing about these agents, the agentic AI models, is that they can help focus you. And so they've started to use some of the agentic AI in dictation software. So there's dictation software that a clinician may be using with a patient to gather the notes from the interview. Mm-hmm. And where the agent can step in is, you forgot to ask the patient's weight, for example. We need to calculate a BMI index, for example. So the agents can step in and ask questions where there's missing information. There has been some work done in ChatGPT, the same thing. And what they find is when there's missing pieces, it does hallucinations where it still calculated BMI, even though it didn't have it.
Right.
And what's interesting, when you ask ChatGPT, is there anything wrong with your answer? It goes back and identifies that it didn't have the patient's body weight. So these agents can be a little bit smarter to say, hey, we're missing something here that we need a data point in order to calculate something. Or here are some potential questions based on the medication. So where these AI and agent models are really helpful are very complex patients. So simple patients, usually the clinicians have no problem, but a very complex patient that may be on 20, 30 meds, they may have multiple morbidities. Those complex patients really require the AI technologies to help the clinician sift through all of their medications and all of their comorbidities. And when they're starting to recommend the new medication they're going to go on or treatment pathway, these agent models can go and scan the literature and say, hey, there's actually a new medication that may work better here.
Mm-hmm. So how much is agentic AI being used right now?
It's brand new. 2 weeks ago, Amazon released their agentic AI framework and architecture on their platform.
It's really fresh.
We are the largest AWS healthcare partner worldwide.
Okay.
And our CTO, Taha Kashot, actually was recruited he was heading up the machine learning division at AWS. So some of these ideas have come from there, but also there's a lot of innovative, from a clinical standpoint, innovative ideas. So where GE is, and it's an exciting time right now, we're usually operational technology, we sold medical devices, but now we're selling IT and OT together. Mm-hmm. And what we're doing is starting to put holistic solutions together.
Mm-hmm. Well, most medical healthcare professionals are pretty sharp people, and you add a new tool to their arsenal, they'll probably take to it pretty quickly. Is that what you're seeing?
This is what we're seeing. So we have some clinicians that are not quite comfortable with AI, but what I'm finding is the new generation is very comfortable with AI, and this is something they're really keen on getting their hands around these new AI tools and working with them. And what we're finding is, and part of my talk, and this is the third part of the talk, is that AI knows things that we haven't actually told it. And so what do I mean by that? And I give the example of AlphaGo, where the top player in the world actually got burned because the computer did a move a move that no human would do, and he lost the match because he thought for sure he was going to win. This is a stupid move, but he lost. So he learned these non-standard moves that humans would do, were kind of completely set him off. So what he did is in the next match, he made a move that no human would make. Thought about this for 20 minutes. It's move 78 in the fourth match, and he actually won the match against the computer. Now, he went on to lose the last two, but what it goes to show us is that we can learn some things from computers, and they can learn some things from humans. There was 20 million moves that were put in by humans into this software package initially, and then they had the machine play against itself, and it actually learned a whole bunch of new moves that humans didn't make. So I think it's an exciting time, and as we get these, what I was saying is when we're moving from these point solutions where we didn't have that interaction, and the AI wasn't really learning from the user, it was just giving an output. Where we're going with this interactive, these agentic and foundational model type solutions is that we're having a conversation. So the AI can be learning from us, we can be learning from the AI, and I think this is going to be a super awesome power in healthcare going forward.
It's really an exciting space, especially from where you sit.
It's amazing, yeah.
All right. Well, Daniel, I appreciate you coming by and sharing what's really happening right now and how it has the potential to completely revolutionize what we do. Yeah.
Well, thank you.
Thanks.
Very nice to be here.